Hi, I'm attorney John Cannon with Cannon Associates, and today I'm going to be speaking to you about the unfortunate topic of bed sores, also called pressure sores or decubitus ulcers. If you or a loved one has suffered one of these as a result of nursing home abuse or negligence, it's not only important to be able to identify what they are, but to also see and understand the levels of these bed sores. In today's video, I'm going to speak to you about the 4 levels of decubitus ulcers, also known as bed sores. The 4 levels of bed sores for nursing home patients escalate in seriousness and also in number, meaning that a level 1 bed sore is the least serious and a level 4 is the most serious and most dangerous. In this diagram I've drawn here for you, it's the layers of the human skin, starting with the top or the epidermis, down to the lower layers of the skin, down to the fat layer, muscle, and bone. A level 1 decubitus ulcer or bed sore is the least serious level, and that's because it has only infected the highest level of the human skin. With the level 1 bed sore, you will see redness that, as opposed to normal skin, that responds to when you push it out on it, where the blood would change color in the skin. With the level 1 pressure sore, you will not see that change in color, and that is one of the greatest ways to identify a level 1 bed sore. Now, these bed sores have some amount of pain and discomfort. However, they are not nearly as painful as higher level bed sores. A level 2 bed sore is the next most serious type of bed sore that a nursing home patient may suffer. And with a level 2 bed sore, the impact can be lower into the skin as well as down into the fat layers. With the level 2 bed sore, there will not only be redness and a rash, but also you begin to see the deterioration of skin and potentially even a small crater into the skin or the fat layers. A level 2 bed sore is a serious risk, but does not by itself indicate nursing home negligence. But it's very important that the medical staff take immediate action to respond to these obvious signs of a decubitus ulcer or a bed sore to ensure that they treat this before it is too late. Before we get to the level 3 bed sores, this is the point in time that medical staff must identify the issue and begin a care plan to ensure that proper treatment is provided. The failure to do so in and of itself may be negligence or a failure to act to take care of your loved one. With that, I'd like to speak to you specifically about a level 3 bed sore now. With a level 3 bed sore is it not only impacting the top layer of skin, the skin itself, but the deep layers of fat. There may be cratering in the area, exposing down to the lower levels of the fat on that skin layer. This is very serious. The treatment be done and be done immediately. You will not only be dealing with serious pain in the patient, but also a high risk of infection with that exposed layers. And also, and potentially most importantly, the issue if it's not treated immediately, those layers of dead skin and dead fat tissue may go into the deepest layers in that area of the body. At the point in time that medical professionals have identified that you or your loved one have a level 3 bed sore, it is vital that that care plan be accelerated to not only include debridement of the dead tissue, but also a wound vac to be removing that dead tissue, which helps to reduce the likelihood of it spreading or further necrosis or further dead tissue in that area. With that, I'd like to speak to you briefly about the most serious level of bed sores that exist, and those are level 4 bed sores. With a level 4 bed sore, we're not only dealing with the issue of dead skin, dead fat, but unfortunately these levels of bed sores or decubitus ulcers are impacting and infecting layers of muscle as well as bone. It's very unfortunate and disturbing to see, and one of the most painful things that a loved one can experience in a nursing home. But the unfortunate fact is that this level not only impacts the top layers of skin, but will go in through the muscle and in through the bone, potentially causing serious infections and unfortunately can lead to death. I'm John Cannon with Cannon Associates, your fierce advocates for nursing home abuse and neglect. We hope that this video has been helpful to you in understanding the process of developing decubitus ulcers or bed sores. If you have more questions, please feel free to give us a call. Also, subscribe to our YouTube channel for more useful videos for you and your loved ones on issues that you may be facing.